question. What's the shelf life on some of the vaccines that we're talking about, excluding the influenza vaccine?
Ms. Erichman?
Chairman Bradley and Representative Walker, just to clarify, the last of the vaccines that used thimerosal as a preservative had expiration dates of January 14th, 2003. So to clarify that. And then
from what I understand, we've got 7 years of experience in reductions of 99.4%. Has there been any reduction or studies of reduction in neurodevelopmental disorders in children over that time period?
Ms. Erzman?
Chairman Bradley and Representative Dean, there have been studies that have been conducted in other countries, and they have found that those rates have continued at their current rate, regardless of whether or not the thimerosal has been removed from vaccines.
And I think that, and in the there's a chart about what you can't get if you do this. We've heard testimony that say if you can't get these, they're going to make more. The only question is, when are they going to make more? And when they're going to make more, when you start asking them to make more. And in one of the letters by a very bright person from the U of M, he asks the question at the end, when the facts change, I change my mind. And what do you do? I think the concern is that we're trying to undo all this immunization business. We're just trying to say, we're worried about this poison that's put in here. And I think that in this age of disclosure, the elements of our healthcare field are that patients are smart. The doctors at the table are very well founded in their training. They're very good doctors. They care a lot. But the people are smart. And they can read. And they hear stuff. And they have concerns. And you have a neighbor with a kid. You have one of my nephew, some kind of nephew, cousin, he was given a shot. And the next day he was not right. Now, it's just a total coincidence. How could that have happened? Just a random fluke. Well, and how many random flukes do you want to go on till you say, let's do something better? You tell the companies, give us some choices. Let the people know. If they would have told that kid that if they got a pertussis shot, different topic, that there's some side effects that might happen, they might have said, maybe we'll wait till he's a little older. Not a bad thing. They wouldn't have gone on TV, but now they have a kid who's got great problems. And did it come from that? Who knows? But they're convinced it's an issue, and they tell their friends. And then the establishment comes with titles and credentials beyond any I'll ever have. And they say, oh, it's nothing. And later on, things are found not to be nothing. This is a two-part bill. One is, be cautious. Do not let people know what they're getting. And then let people decide, and they're going to pick what their doctor tells them to. But there'll be some who would say, I wonder if I have a genetic predisposition to that. What's my family history? Maybe I should get another test. And if it's true, the people at the table in the room who want us to not talk about this are going to have something on their conscience they would rather not have had. And if we're wrong, we spent $4 more a shot. And we spent some money. But there's a lot of evidence that it's not nothing. That it's not nothing. In fact, every advisory group says, use it less. Well, if that's a hint to me. And so the doctor summed it up well. Better safe than sorry. And that's all this bill does. And I would hope that and one thing else, the less that the society, the culture, that the legislature or that a bureaucracy seems responsive to the people, the less they trust the whole thing, as was mentioned earlier. And so I think to do nothing and to say it's fine is to subject other things that you even have more strong opinions on to disbelief. And you go there at your own peril, and the harm you fear will actually occur as an unintended consequence. So I think I support the bill.
Well, it strikes me, in trying to listen carefully to the debate, we could forever and ever probably find study counteracting another study. And now I happen to believe that the overwhelming evidence is that there is not harm, but I understand there's people who interpret and see other studies differently. But the thing that strikes me the most strongly, I guess, in this whole discussion is that I see a whole list of organizations and people who dedicate their lives to the health of people. I mean, just look at this. American Academy of Pediatrics, American Liver Foundation, Children's Hospital, Local Public Health, Minnesota Academy of Family Physicians, the National Association of Pediatric Nurse Practitioners, Minnesota Medical Association, the Pharmacy Association, the Public Health Association, and I actually could go on. And these are organizations, I mean, we're not just talking about sort of onesie-twosies, we're talking about the large body of people who live every day in protecting and saving lives. And for that overwhelming set of groups to tell us that the best advice is not to pass this,
Well, Mr. Chair, you gave part of my speech about the organizations that are opposed to this bill, and the American Academy of Pediatrics and the Pediatric Nurse Practitioners, the Mayo Clinic. Do any of these groups have a vested interest in this other than doing something for kids' health and adults' health? It's the most impressive list of organizations I think that I've ever seen standing up on a particular healthcare issue. Do scientists always agree? No. I mean, there's a tenured professor at Berkeley that still claims that AIDS is not caused by the AIDS virus. And I suppose you could quote him and try to pass a law that says we should not give antiviral drugs to people that have AIDS. Look at that list of organizations that Representative Bradley went through. And if you can't trust your American Association of Pediatrics and pediatric nurse practitioners, who can you trust?
From all the testimony I've heard, I haven't heard one person in the medical community or in the Department of Health say that thimerosal is good for you. I haven't heard one person say that thimerosal is something that they can't do, you can't do without, that it's going to help in any way prevent disease. And I also heard that there were other preservatives than thimerosal that we could use. In the medical community, I understand that they're very concerned about whether or not people get immunized, and they should be, and I'm glad to hear that. But we've also heard the medical community agree on a number of things that have later they've changed the process or the procedure or their thoughts on that issue. I still don't understand why we are sitting here and defending a substance that there have been many studies on that have shown problems with, that we know mercury, no matter what kind it is, has problems. We're trying to get mercury out of our water. But now we're saying it's still okay to inject it into people's bodies, even though we know it's a dangerous product. So the medical community is worried about one thing, and that's making sure everybody gets immunized, and they should all be together on that, and they are, and that's wonderful. But I'm not sure that they should all be together on fighting this legislation, because I think they're going to find that less people are going to get immunized if they're concerned about a byproduct in those shots that could cause them problems. A product that is not necessary to anyone's health.
I renew my motion that House File 1505 as amended be recommended to pass. Members all understand that motion? All those in favor say aye. Aye. Opposed, no? No. The motion does not pass. There being 6 in favor, 8 opposed, the motion does not pass.